Hello, everybody, and welcome to this session on neurodiversity. I am Dr. Gowri Chinthalapalli. I'm a family physician and I've specialized in child development. And I work in Aster CMI in Bangalore. So now over to Ms. Sushma.
Hi everyone, my name is Sushma Gopalan. I work as a child life specialist in Aster CMI. I am familiar with being a clinical psychologist and a counseling psychologist. Over to Ms. Apoorva.
Hi everyone, I'm Apoorva. I'm part of the child development team here at Aster CMI Hospital. I work as a psychologist. Can we start off with the session?
Yes, thank you so much. So we are nowadays hearing a lot about the term neurodiversity, and it's a very commonly used term. We hear it in a figure of speech, we watch it in TV, we see it in read it in papers, so many. But what exactly is neurodiversity, and why are we taking it as something which is different? So I would like Dr. Gowri to answer the basic topic as to what do we mean by neurodiversity.
So, to understand this, let's go back to our history from the time of evolution. If you go to a prehistoric, historic, there is so much we have evolved from that time, and we are still evolving. So that is why these terms you're hearing it now more often. So with times we have evolved. With evolution we have made changes around us. We are adapting. So we have to adapt for our survival. And with this comes this new changes. So if you even look into 2 or 3 decades back and to now, there was no computers, there was no gadgets, and we knew work was work. When we come home, we didn't have gadgets, we weren't working, or we weren't hooked on to this social media and everything. Now times have changed, so now we need to see what all this is doing to us, how it is changing us. So from then to now, the family dynamics has changed. From joint families we are becoming nuclear families. So the burden of how much we have to manage is increasing. With that comes the type of lifestyle we are leading. Now moving on to the word neurotypical. So neuro means anything related to the brain and nerves. Typical, you all know, it is like how it is normally what we find naturally around. So neurotypical means what we have in our mindset as what is normal or within the normal range. So everybody is different. So we cannot say this person is neurotypical, this person is not, just by comparing two individuals. So it is about the normalcy among most of the people. So that is neurotypical. So if there is typical, there is divergent. So there is a term called neurodivergent. Divergent means away from typical. Being neurodivergent or not being typical doesn't mean there is a problem. When we are seeing more and more people now with these labeling as neurodivergent or having these conditions, it doesn't mean they are abnormal. That is why this thing of neurodivergence has come into picture. It basically means we are all different. The way we look at each thing is different. Like if you're standing at different sides of the number 6, one perceives it as 6, the other perceives it as 9. So the way the brain is functioning, analyzing things and reacting may be different for the same situation. And how do we put this together and work around with each other to make it normal is what is all about neurodivergence.
Okay, so to sum it up, it is basically saying there is no one right way. Right?
Yes.
So all of us are different, and it is how we take each other. And it is just becoming aware of each other's plus and minus. That's it. So we understood what is neurodiversity, but I would like to understand from where it all started. Getting to the root is very important. So what is the root of neurodiversity?
The term neurodiversity was coined by Judy Singer. It started off as a term that encompasses different cognitive functions. Each of our brain, like fingerprints, are not alike. We are all developing differently, and therefore we have different cognitive functions. The term neurodiversity is now used broadly to include many conditions such as autism spectrum disorder and others. The term now is also being used in organizations and workplaces where neurodiverse individuals are being hired.
So now moving on, what are the conditions that fall under neurodiversity?
There are 6 conditions that come under this category. So they are autism spectrum disorder, attention deficit hyperactivity disorder, Tourette syndrome, dyslexia, dyscalculia, and dysgraphia.
So when we say about all these conditions, what are the traits that we generally observe for all these conditions?
One thing that you need to remember for such conditions is their intelligence level is actually good.
Okay.
So their brain functioning is fine. It is just one part of the functioning is where it is affected.
Okay.
Like in autism spectrum, it is more of the social connectedness. They may not understand when we are talking to each other what it really means. They may look it as black or white. Similarly, with attention deficit disorder, they cannot focus or concentrate for long time. They may need repeated prompts. They may get too deep into one particular subject and be there and lose focus on the other necessary things. When we come to dyslexia or dyscalculia or dysgraphia, it is specific difficulty. Maybe they will not be able to read like how we read. It is like a jumbled up words, or when they're writing it may be similar. And with dyscalculia, it is about mathematical numbers. Areas around this in daily life also you see them struggling, but these can be supported and we can work together with these conditions.
Okay.
So we understand this, we can help them.
So thank you, Dr. Gowri. That was pretty informative.
So now we have seen an overview of what comprises neurodiversity. Now moving on to what are the challenges these people face. So Ms. Sushma, do you want to say?
Yes, so we have spoken about different conditions, and now we are going to just break down the conditions and the issues or what they might face. For example, a person with dyspraxia, they might have difficulty with planning, okay, movement, or anything which might require a little bit more of the time investment. Dyscalculia, it's basically to do with math. So any number concept, any calculation, they'll have a problem. Dyslexia is basically to do with words. So there'll be problems associated with reading and writing. ASD, it's a huge spectrum. So anything to do with social and communication, they will have an issue. Tourette syndrome, it's any kind of physical or verbal tics that they might face. So all these, when it encompasses, different individuals might show different levels of difficulty. ADHD, so they can be either hyper or they'll be too focused. Again, the conditions are varied. So it depends from person to person.
How do you think they can cope with these challenges?
Okay. So it depends when it is identified. If it is early, probably the family can help with time management, being more routine oriented, schedule oriented, increased amount of creativity, initiating different kind of tasks, being more resilient, teaching a child to be resilient. When they become an adult, again, the external atmosphere can be changed so that a little bit of positivity can come into the person, how the atmosphere treats that person, coming up with different plans, seeing to it that whatever shortcoming the person feels he or she might have, the person might not have actually, but can feel they might have, how to help them with that can also help an individual.
So you're saying you can actually plan things ahead.
Yes.
Have some schedules.
Exactly.
Or sticky notes.
Yes.
Or if they're gadget friendly, they can
Yes.
have to-do list.
Yes.
There's so many things out there.
Basically,
If
yes.
they understand, they
Yes.
can work around
Yes.
their difficulties.
Exactly. It is just a point of being empathetic, being a problem solver, and being logical at the same time.
We've been talking so much about how they are different, what are their challenges. But we are saying let us include them, inclusivity. Do you want to elaborate on how we can utilize their strengths to work better?
Yeah. So the conditions that we spoke about earlier, a lot of them bring in a lot on the table in the workforce. So if there is a person who is on the autism spectrum disorder, they will have certain passions, certain interests that they are really passionate about. A person who's ADHD or attention deficit hyperactive disorder are naturally very creative people. They can naturally multitask and they can naturally be very, very innovative. A person who's dyslexic, having difficulty reading and writing, but are very good thinkers in 3D. They can almost imagine their products already being prepared in 3D. And somebody who's having difficulty coordinating their body movements or their physicality, they are very, very good at being good friends, right? So they're very sympathetic, they're very empathetic, they're very, very creative people. In popular fiction, we have a lot of examples. We have a lot of movies such as Tare Zameen Par, we have My Name is Khan. We have a lot of movies that have these neurodiverse individuals which came up with so many strengths.
So you're trying to say that even though they had strengths, they had challenges, they had strengths, and it doesn't mean that they are abnormal or we have
Yes.
to discard them away. We can,
Yes.
when we work together, we can use each person's strength. All of us are different. All of us have some traits of all these things. So we
Yeah.
can put them together and bring out the best in each other.
Yeah.
And in movies, when all this happens, we clap hands, we are so happy that they're included, we go watch it again, we spread it around. But when it happens in real life, why don't we do it? So that's why the movies are made, so that there's something that we carry away. And I think even Forrest Gump is one of those movies which encompasses this.
Yeah.
So when we go to a movie, sometimes there are messages that can be taken away, and this can be a part of it.
Sure. So, like, I think to sum up, we can say they're different. They are not less.
Yes.
So, neurodiverse individuals have their potential that needs to be reached during their development as
Yes.
children,
Yes.
as well as when they enter
Adults.
college and in the workforce.
Of course, yes. So we have spoken about so many pointers. Now I would like to ask, what are the risk factors or challenges that are associated with a neurodivergent individual?
One of the challenges is related to mental health
Yes.
issues.
Yes.
When they find this constant challenge of not able to do something or understand, they may feel left out or go back. So they may withdraw within themselves. Sometimes it can come out as frustration. So that is external. They'll show it outside. They are at a bit more higher risk of going into depression, having anxiety. It can affect their confidence or self-esteem. This is important for others around to understand and support these children. That is one of the challenges.
Okay. To add on, I think the other challenge that they have is underemployment or no
Of course,
employment
yes,
at all.
Yes.
Because though their intelligence is good, they might not even pass your interview stage at an organization simply because they can't be social or they can't articulate what they are thinking, or they may not do too well in the written entrance tests that they have at organizations.
Of course, yes,
So underemployment or no employment is, I think, again, one of the challenges that's present.
And to add on to that, I think even relationship challenges are something that they have to face. So we have, when we are talking about social interaction, it is inter and intra also. So they might have problem or challenges in addressing their family members or how they might take them up. Challenge in making friends, peer relationship can get affected. So what's happening is we are asking people to be sensitive. We're asking people to be sensitive to others, but what we see is people are becoming sensitive to themselves. So that gap has to be filled, and when these are addressed, not just a neurodivergent individual, even a neurotypical individual will benefit from that.
So you're trying to say, let us make it a normal
Yes.
thing. Let us put out our feelings to each other so
Yes.
everybody understands they go through similar things. So it is normal to go through it. We don't need to hide it and suffer
Exactly.
inside.
And be sensitive to others, not to oneself. So you be sensitive for another person, not for yourself. That's all. Yeah.
What are some of the myths that are surrounding neurodiverse individuals?
One of the thing is they don't have emotions. Does this mean you can say anything to them, whatever you feel like?
Okay. Also, does it mean that they don't want friends? They like to be left alone. So you don't interact with them because you feel or you assume that they like to be alone?
Do you think they procrastinate a lot? Do you think it is deliberate?
Okay. And do you think that they're arrogant, they're snobbish, they don't want to interact, they don't want to mingle, they don't want to associate themselves with you? What could it be?
Do you think they don't have a family life? They can't have a family life, or but
because-
which family doesn't have problems, and
So-
everyone has to adjust?
Exactly. So are these reality or are these what are the assumptions that we have made?
That is something to ponder upon.
Yes.
Now that we've understood the myths around neurodiverse individuals, what does one do if you identify yourself as a neurodiverse individual, or your sibling or your child in the house?
Imagine if you have any reading or eyesight issues. You go to a eye doctor, you get tested, and based on what you require, you get your glasses prescribed and you do it.
Yes.
Similarly, if you are facing challenges, by going through all this, a lot of you think that you also have somewhere something, some challenges around all these, but not everybody needs input or therapy. Things become a challenge or an issue when they're affecting you in your daily life, in some functioning, in any form of functioning. Like we've discussed, it could be in school, with peers, or workplace. If you're struggling and this is affecting you, you need to go seek professional help. For children, you can go see your pediatrician to get initial guidance, or you can see a pediatric neurologist, pediatric psychiatrist, or a child development physician. For older people, you can see a family physician or a psychiatrist, and they can guide you. Once they see you, talk to you, they will understand what is happening and what assessment needs to be done, and then formulate how we can help you. But one thing, remember, this is not very easy like a blood test. Do it, you get a result, it is black and white. Sometimes we may need time to understand the whole process. Things may overlap. To get a clearer picture, we may need time. So be patient. And the therapy is also not a tablet or an injection where you do it and it is solved. It is about evolving over time, developing coping skills. When you're directed to the therapist, go see them, work with them, and then you can actually see good results. It is very important in your children if you start seeing this to start then itself, because at that root level where they're growing, if the base is made strong, resilient with coping skills, as adults they can do much better.
Okay. So we are saying we have to identify the red flags. Yes. And also come away with mental stigma. I don't have the stigma of, we should not ask it because it's a mental health issue. And third, understand that this is an individualized program.
Yes.
Each person is different, so the therapy will be different. And acceptance.
Very important. Like I gave you the example of glasses. Before that was a stigma, now it is not.
Yes.
So
exactly,
let
yes.
us do the same here.
Yes.
We've been speaking a lot about trying to include neurodiverse people. What exactly do you mean by being inclusive?
Okay. Inclusive is for everyone. So it means to embrace all kinds of people. So for me, someone else might be different. They have to be different. So it is not just applicable to neurodiverse per person. It is for everyone. So you're embracing everyone for what they are or who they are. There is no discrimination. There is equal access, equal opportunity given. There is equal treatment. You are treating another person as a human being, accepting them with all their strengths, weakness, everything. Because when we meet a person, we have a certain expectation from the other person, and when that expectation is not met, we label them. So why do you meet someone with an expectation? Be an open mind, accept them as who they are. So at that time, all this labeling will be of no matter. That is what is inclusiveness, to just accept the other person as they are.
And a lot gets reflected in the tone that we speak
Of
with,
course,
the language,
yes.
the words that we use.
A look,
A
one look,
Yeah.
it's just a look, but it carries a ton of message.
Sure. So we have to be sensitive in
Of
our
course,
body
yes.
language around
Yes.
people,
Yes.
the tone that we use, the
Yes.
words that we use.
Yes.
Yeah.
Our intolerance to certain things. So when we manage all that, inclusivity comes automatically. Yes.
Let us move to how we can help neurodiverse individuals within our home and our organization and in our teams. What can a family do? What can family members and relatives do to help individuals with neurodiversity within our household?
We have looked into how these people struggle. So creating spaces, they may feel very overwhelmed when too many things are expected for them to do.
Okay.
Sharing what can be done, having a little breaks. If it is getting too much, it is okay, just step out, breathe for a minute, come back and do it. Or if you just want to pace up and down for a minute, it is okay, you will feel more relaxed, you can come back and focus again and go back to the task, rather than sitting in one place wanting to finish it, getting overwhelmed and not doing a good job.
Okay. To add to that, I think they also need opportunities to practice social communication. Whether it is to communicate emotions, whether it is to communicate a difficulty or a problem or a conflict that they are undergoing, whether it is to communicate a request or asking for help. I think they need to have family members encourage these skills within the household, isn't it?
Yeah, and for both of this to happen, there has to be acceptance in the family and the extended circle. Because nothing will happen if there is no acceptance, and the inclusivity that we are talking has to be there. It starts from the family. So when that acceptance factor is there, things do fall in place.
So we need to kind of create that atmosphere so they feel okay, they can open up, they can share,
Yeah.
and we can have a time, a family time, which we are losing out. What we used to do before, sit together and eat,
course,
or
yes.
just have a time you go out, just you're being without gadgets also,
Yeah.
and talk about what is happening inside, so the other person understands it is not just you or me, it happens to everyone, and they will find that strength
Of course,
from
yes.
each other.
Yeah.
Similarly, everybody needs to have a self-care rituals,
Yeah.
right? Everybody needs their me time. Everybody needs to have something to help their physical strength, their physical stamina, some ritual or activity to take care of their mental health. So self-care rituals in place for all members within the household, I think, again, will help them to cope with will help each member of the family cope.
And everything starts from the family. The root is the family. So how a child is made to feel at home is what is going to be reflected outside, be it a child or an adult. So how accepting they are at home, how normal, we label normal so much, but none of us are also normal. So how normal they are treated at home is also a matter to be concerned about. So they have to feel that acceptance. Yeah.
So we looked at how at home we are supporting each other. Now moving on to the next step, we are going out, working, peers, employers. How can these people support
Okay.
to be inclusive?
I think One of the first things that co-workers can do is to have distraction-free workspaces. A lot of the conditions that we've spoken earlier require that the space around them to be clutter-free, so that their mind and thoughts get a bit organized, and therefore their work and productivity gets better.
Yes.
Moving on, if they are struggling to work in a workspace, give them the option of work from home when possible.
Yeah, that makes sense. And also, if an individual is very sensitive to sound, you can have noise cancelling headphones,
Yeah.
So we are stuck with earphones listening to music, and I'm sure they will enjoy it if there's no noise. So we can make that arrangement.
Sure. We also spoke that they are at risk for mental health difficulties.
Yes.
So maybe mental health days off to be help them to cope with the stress that they are feeling.
On similar lines, they may not be okay with the certain time schedule patterns. Having a bit more flexibility around when they can log in or log off, when they can come in or off, is a good option.
Yes. Workshops can be conducted where the team members or all the employees can understand what is the latest approval, what has to be done, how can we be a bit more sensitive, what do we do to bridge a gap. So it will be a two-way program. So all people will get together and they will try to, understand what's going on in the other's plate.
Right. So these are some of the accommodations
Yes.
that co-workers can give. But each individual needs to find their own coping mechanism or their own accommodation within the workspace to help them function smoothly and have better productivity, isn't it?
Yes.
So individualizing these plans is very important.
Yeah.
So throughout you have seen how three different individuals have been sitting together and giving one kind of a program. We have used our strengths together. We have helped each other out to get this outcome here. She is good in planning, organizing. You see her with notes. I come up with ideas. She is very innovative, very creative. That is why we could present this to you. So let's work together.
Togetherness is strength, and variety is something which is very essential. So when you meet different kinds of people, you learn more about yourself. So why are we not accepting towards that?
With that, we leave you to
Ponder.
ponder.
Yes.
Thank you.